Skill number 23 measures and records manual blood pressure. The materials that you will need for this skill is a blood pressure cuff, a stethoscope, and alcohol wipes.
Knock, knock. Good afternoon, Mr. Smith. My name is Chris. I'm going to be your nursing assistant today. I'm here to check your blood pressure. Is now a good time? I start off by washing my hands, confirming your identity with your wristband, providing privacy, and gathering my supplies. The supplies that I will need for this skill is a blood pressure cuff or sphygmomanometer, a stethoscope, pen and pencil, pen and paper, and alcohol wipes. Alright, I will start off by cleaning my stethoscope's diaphragm, also referred to as the bell, and the earpieces. For testing purposes, the participant will have to use a dual stethoscope so that the proctor can hear. Move this out of the way. Now the patient has to have his feet firmly planted on the floor, arm at heart level, palm facing up. Okay. For this skill, we're going to be using the brachial artery. If the patient has his palm facing up at heart level, the brachial artery runs along the pinky side, right here on the upper arm. There's two of them, one in each arm. We're going to use a 2-finger space above the bend of the arm for our blood pressure cuff. So we start off with our blood pressure cuff facing up. There are 2 artery indicators, left arm and right arm. We're going to be using the right arm today. Placing it a couple of finger spaces above the bend, right here where the brachial artery is located. Making sure our supplies is set up. We're going to go ahead and clean our stethoscope, diaphragm, and earpieces. On the day of the state exam, the participant will have to use a dual stethoscope so that the proctor can listen to what they're doing. We place our stethoscope over our ears, tap on the diaphragm to make sure that it's on to the adult side. Place the stethoscope also on the brachial artery above the bend of the arm. And we're going to pump up to between 160 and 180 millimeters of mercury. Now on our sphygmomanometer, we pump up to between 160 and 180 millimeters of mercury. As we deflate the cuff, we're listening for the consecutive beats, and we're listening for the first sound and the last sound. Now for this particular patient, we got 110/60. On the sphygmomanometer manual blood pressure cuff, it's always even numbers only. It goes by 2s. Now next up, we're going to go ahead and show what documentation looks like. After memorizing the number and not saying it out loud, I'll go ahead and do my outro with my patient. Mr. Smith, here's your call light within your reach. Let me know if you need anything. I'll go ahead and remove the privacy curtain. I'll double check that your wheels have remained locked and your bed is in the lowest position possible. I'll wash my hands, report and document, and then my skill would be complete. Now for testing purposes, we do have to fill out our documentation sheet, which I have already written down here, candidate results 110/60 written as a fraction. Some people like to write down mmHg for millimeters of mercury, but in this instance, it's not required as long as we see the fraction written under candidate's results. Evaluator's results have to be very close as well, and then you would turn this into your proctor.